Hi everyone, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today I want to talk about the trending topic of healthcare worker burnout. I am sure that this has been discussed or you've heard about this within the last few years because it really started gaining momentum and awareness during the pandemic. And since the pandemic has ended, it still is continuing for multiple different reasons where healthcare workers are just getting burnout and often quitting from the field entirely. And this is causing a lot of concern throughout the nation because of the deficit that it lays with patient care and also patient safety. It's also something that is trying to be prevented, and so awareness is being put out there. The American Surgeon General has made statements about it. If you go to the hhs.gov website, there's a whole page dedicated to this topic. So it's just something that I felt was necessary to discuss, especially for the managers, the providers, the owners that are watching this, that are in charge or oversee employees, and for your own well-being as well, to make sure that awareness is brought to it, and also how to identify possible employee burnout, as well as maybe trying to prevent burnout too. Yes, this can happen in any field, any career, any area where people work, burnout happens, but because healthcare workers are responsible for taking care of other people, especially vulnerable populations, it brings even more discussion and concern. Not only for, like I said, patient safety, but also patient care and for their own well-being of the individual. Some contributors to healthcare worker burnout are structural, cultural, societal, and organizational factors. This could be as the field as a whole, but it also could be independently at where people are working, and it also could be the specialty in which people work or the geographical area in which they work. There's a lot of different moving parts and facets to this, but those are just some of the contributors. Also, the lack of providers out there, especially in certain specialties such as primary care or rural care. The demand for physicians alone is huge, and it's anticipated by 2033 that there will be a deficit of physicians in the United States between 54,000 to 139,000, mostly felt in the primary care realm and rural medicine. So even though we are feeling the pinch now, it's only going to get worse based off of what they're seeing in their kind of forecasting of how many people will be graduating medical school, how many graduates are being pulled to these different specialties or not pulled to these different specialties. So we're talking about all different areas of healthcare. We're talking about the people who have direct patient care, we're talking about providers, we're talking about managers, we're talking about administrators, we're talking about leaders. It's just really, really sad. And there are some things that you can do to try to identify your employees if they're having some burnout. And some of these things that you can identify, and of course, these are going to be kind of signs and symptoms, if you will, of other things that could be going on, but at least it would help you as a leader in the practice organization, maybe approach the employee with concern in private and say, look, I'm noticing these certain things. What's going on? Are you burnt out at your job? Are there personal situations going on that's affecting your job? Is it both? And then seeing if you can get them some help. Maybe it's getting them some counseling or some mental health. Maybe it's giving them some time off or encouraging them to take time off. So some of the things that you can look for if you're concerned about employee burnout, which you should be even if you aren't in healthcare, is, are your employees being more irritable, or is an employee being more irritable than normal? Are they kind of being more negative or showing a lot of cynicism? Just overall, do they show emotional exhaustion? Are they pulling away from their friends and colleagues at work and it's not like them? Things like that. Are they less likely to volunteer for something that they normally would jump at? Do they seem less happy? Are they missing more work than normal? Are they talking about, or are you noticing other people talking about maybe their increased drinking or something like that outside of work hours? Are they noticeably not taking care of themselves physically, like hygiene wise, or has that declined? Those are symptoms and signs of depression, anxiety, overwhelming someone. And again, it might not necessarily be because of burnout, but it could be something else, and it could eventually lead to burnout if it isn't already. And these are the things, as being a good employer, that you should be looking for and asking the right questions for those employees that are showing some of the possible signs of employee burnout. Some ways to try to avoid employee burnout is encouraging your staff to take their well-earned time off, encouraging them to take their breaks during the day. I am the number one person that can speak for this, that I've gotten so busy in my roles that I don't take a lunch, or I didn't take a lunch. And it really does wear on you. And it really is important, even though at the time it seems more important to get the work done and not take the break. But mentally, physically, in the long run, those breaks are really important. Even if it's a half an hour to completely walk away from the desk, completely get out of the environment in which that individual would be working, not sitting at their desk for lunch, not sitting where they would be pulled into maybe doing something or thinking about work. They need to completely disconnect. Encouraging them to use their sick time if they have it. If they're not mentally well, they need to take some time for themselves. Or if they're pushing themselves through a physical illness, encouraging them to utilize what they have to stay home and get fully better instead of feeling the pressure of having to be at work. Rewarding your employees for doing a good job. Even the thank yous, the attaboy kind of thing, like that goes a long way. It might not take a lot from you to say, oh my gosh, thank you so much. I noticed you did this. I appreciate it. Or you did this really fast, or you're doing a great job. Please keep it up. It goes a long way with employees, just knowing that somebody is paying attention and noticing them doing a good job or going out of their way or doing something faster. That appreciation is huge. Also, asking for employees' input when changing procedures and policies, asking for their review, and honestly considering it, having dialogue with them, telling them what the idea is and see if they have a better idea, or coming together and brainstorming and coming up with a collaborated idea. Employees like to feel heard, and if they can have some kind of skin in the game, or they can have some kind of input that is taken genuinely by their leadership, that goes a long way as well. Also, having flexible schedules, offering flexible schedules, telling them and showing them that family does matter to a certain degree, and that if they needed to leave earlier in the middle of the day to take their child to an appointment and come back, you'll find a way to work around that. Or if they need to leave early to go to a ceremony at their kids' school, encouraging that once in a while. And again, there is a fine line between employees exploiting that, but also letting them know that family is important and personal life is important, and finding that balance. That goes a long way with employees, and it's really hard to find in larger organizational structures. So being mindful of that and finding a way to balance that and communicate to your staff it's important, but also work is to help them learn how to balance it as well. Healthcare employee burnout, it's just going to be one of those things that we're going to have to deal with, and making awareness, talking about this out loud with everybody, having very candid conversations with our employees, our providers, being mindful with the administrative burden, especially on providers. They get really overwhelmed anymore, and just making sure that you're acknowledging that they're having to work harder, or that they might be going through a tough streak, so that they don't think that people are just ignoring it or expecting it out of them. Sometimes just walking up to them and saying, look, I know it's been really hard. You've had a really busy schedule. You've had a lot of this or that. And if you need any help, I'm here for you. Or thank you so much for doing that. I know it was a lot of extra work this week. Something like that just can be a huge mental situation to alleviate maybe some extra stress or depression on somebody. And so being cognizant of that is huge. So if you're a manager, an employee, acknowledging the provider's burnout, providers acknowledging your employees and the staff that work around you burnout, and then the owners to also be aware of everybody, right? Because ultimately, if you're employing anybody, whether it's a provider or they're your staff, you are ultimately responsible for their work well-being, and this all contributes. If you have any questions or comments about this, please leave that in the comments below. Smash the thumbs up button if today's video was helpful. Subscribe to my channel if you haven't already, and please share this with your colleagues so the word can get out. Thank you so much. We'll see you next time. Bye-bye.